Now we have got an important topic uh, for discussion, that is regarding the group practice harmony. Because you are going to invest on a building, you are going to invest on the equipments, and similarly you are going to invest on your professionals also. So to keep them together is a big process. And Dr. Vinay is managing 20 full-time consultants and 30 visiting consultants. He is the right person to talk to us on how to maintain harmony between not only the consultants, between all the staff. Over to you, Dr. Vinay.
Thank you, sir. I'll first of all like to thank ASOS for inviting me over to this very interesting webinar, which is actually the future of our ophthalmology practice, the way it is going to be. So I'll just start with my presentation. Just a small disclaimer, I don't have any answers to the topic that has been assigned to me. I've been assigned a group practice harmony, but this is the most difficult and most challenging thing that we all are still searching an answer for. So maybe what I'll be sharing with you is my experience with the group practice that has been there, the goods and bads both. And of course, each one of us will have their own experiences. I'm not going to give you any formula on how to succeed, because to be honest, there was a practice in which I was in a group and we just separated 4 years back. So maybe I'm the last person to be coming to be talking about group practice harmony, or maybe the first person to be coming to, because I'm the one who knows what can go wrong also. So I can just share with my experience. And as I'll be saying later, we have to learn from each of our experiences, whether it is good or bad, because everything in life is a learning for us. So let me start with stating the obvious, that group practice is the future, or rather the presence of the practice nowadays. It's becoming more and more difficult to run an individual practice. But what is important is that whenever you're going for a group practice, it requires a lot of team effort. It is not a single man's job, and the team has to work together. The advantage is obvious, that you get faster return on investment whenever you're in a group practice. So it's always better to go in a group, because that way you can straight away start with a better quality setup where you can provide all the services to the patient, but you can also get the returns faster. Gone are the days when people will start with a small ophthalmic chamber where they will only do refractions and maybe maximum of echo, because now when the patient comes to you, he expects everything. Like the previous speaker talked about the machines that are required. So the bare minimum, OCT is become a bare minimum for every practice to have. Similarly, there's so many other things that are bare minimum. So for a beginner to start with all these things becomes more and more difficult. So that is why group practice becomes more and more important in current scenario. Of course, the other concern about too much of compliances that are required that we had in the previous talks and all. So, it is becoming more and more difficult for a single practitioner to take care of all those requirements. So group practice is the answer. Now, what is important is there has to be a good synergy between the various partners. And as the term synergy comes from synergistic effect, where both these segments are benefiting. It is not opportunism, it is not parasitism, it is synergy. So you have to have a win-win situations where both of us, both two or more people who are coming together, have to benefit from each other. And we have to complement and support each other, because someone may be having some weaknesses that can be complemented by someone else's strong points and vice versa. So it's basically a team effort. So there can be two models that can be there in group practice. One is a multiple owners model, where two or more people are the owners, they put in their money. So there are more than two people who are responsible for the management and the other things. This is the model that I had followed earlier. And since 4 years, I have been doing a single owner and multiple users model. So I'll be briefly telling you about those things. Now, before I go on to my talk, I would just like to give a brief background about me. I basically did my schooling from a small town in Varanasi, and I'm coming from a business family. So there was no one in the professional in my family. So I got no backing of any doctor in the family. I came to Delhi in 1989 when I joined my MBBS at AIIMS, did my MD in ophthalmology there. During a brief period that I was free, I went to UK for doing my FRCS in 1998 and came back and joined senior residency in the retina unit in RP Center, which I finished in December 2001. So this was my education and training period that was there. So towards the end of my senior residency, there was of course the question about what do I do with life. I had an option of either going back to Varanasi and setting up a practice out there, staying back in Delhi, going to UK, I had an FRCS degree with me, or going to the greener pastures of US, as most of the AIIMS students would be going there. But then I didn't want to leave India. I wanted to be in India, but I wanted to be in a bigger city where I could make a bigger difference. So I decided to go into a private practice with a colleague of mine. And this was very important for me because alone I would have found it very difficult to establish in Delhi. But because there were two of us, both of whom happened to be retina specialists from trained at the same place, it was very good for both of us. We complemented each other. So we established a retina setup in December 2001. But along with the retina setup, we continued to do our phaco as well. Now this is important because many people told us that if you do phaco, no one would be referring your retina cases to you. But we said, no, since we know our phaco, we'll continue to do phaco, but we'll be very honest about it. So any patient who gets referred to me for retina, he would not be offered a phaco, and he would be actively be sent back to the referring physician for the phaco services. So this is where we kind of established that, yes, we are going to do an ethical practice, and we are not going to be poaching upon the others' patients. This goodwill came in important later on also when I'm going to be talking about my group practice model. During this period, I also started to do LASIK. I learned LASIK in practice, and then slowly our numbers grew and we added a femto suite at our center as well. Now, other specialists also were joined our center along with us, who would provide the other services so that we could cover each and every segment. So we had cornea and glaucoma and oculoplasty specialists and the other people joining in. So, and a few of them joined on a fixed salary as well. But what happened about 4 years back, we had a fallout with my partner, and that is when we started with a private limited company, but then I established my own Synergy Eye Care LLP. So as it was with my predecessor, there was a talk about LLP and the private limited company. I found more benefits in an LLP, so I switched over my business to an LLP. So I named it as Synergy Eye Care LLP, and I decided to have these three main goals of compassion, competence, and integrity. So these happen to be my main focus points, the key areas where I would like to stress about our values. And this I made it as a part of my logo also, so that everyone who works at my place, whether he's a staff, visiting consultant, or a referring doctor, they should know that we stand for these three things. Compassion, we treat the patients with best possible care, compassionate way. Competence, we want to be up to date, whether it is the doctors or even the optometry staff or even the cleaning staff. They have to do their job in the best possible manner and in an honest and integral way. So that is what we want to emphasize upon each and every person. So this became a part of our logo. As of today, we have got 4 full-time consultants, including myself, who are on, the 3 of them are on salaries, except for me. Then we've got 15 consultants who are coming to my center and who are using the OPD, investigative, and OT facilities. So these consultants have their name on my duty rosters, in my OPD appointment sheet, and the other places. And we have got many visiting consultants who are coming to use the LASIK or the OT or investigative facilities. So they are not having their regular OPDs at our center. So there are about 30 of them who are kind of sending their cases to us. So this is what we have been able to achieve in a very small space of only about 5,000 square feet, where we are doing about 300 surgeries a month. Now, there can be 2 kinds of models that we can have in group practice. As I said, first can be a multiple owners model that I was a part of earlier. Now there, the advantages are that the administrative responsibilities are shared between 2 or more people. So there are more working hands that are there with you. It is especially very useful at the beginning stages of your practice. And we complement each other's weaknesses. Like for example, I was very weak at marketing. My partner was very good at marketing, but I was strong with the system. So we kind of could complement each other, and we could fill in for each other's weaknesses. The other advantage of a multiple owners model is that the person who's got a skin in the game is going to be much more committed than a person who's there with you on a salary. So in the initial stages, especially when you give your sweat and blood to the organization, it pays to have someone who has an equal or some stake in your organization. So that is what was the advantage that we have. But the problem that happens in the later stages of the practice, sometimes your personality issues and the other things kind of start to creep in. And especially if you have not planned a separation very, very clearly beforehand, these kind of differences may start creeping in. So what I believe is that the differences come up either in the early stages of the group practice where you kind of don't match with each other, or after 10 to 12 years or 15 years of practice when you have kind of established yourself and now you kind of have your own other smaller things like your egos, your work ethics, or other things coming into play. And then you kind of are not willing to adjust to the other person. So what I would suggest to the people who are getting into private practice in a group practice together is that you should have a kind of an exit clause, say 10 years down the line, where you can say that, okay, after 10 years, this is where we are going to be standing and we are going to reassess our situation, and we can extend it by every five years or so. So, if you feel that, yes, you have achieved what you wanted to achieve, but now both of you want to go in different paths, you have a very clear-cut defined separation route that is there. I know this is a very, very difficult part to achieve. I know of many practices which have kind of separated. There are a few very successful models also which are continuing, but it is a matter of chance that your ethics should match the other person's ethics and so many more things. The decision making may become more difficult with a multiple owners model because each one of them would have their own personal choices. Initially, the decision making is much simpler because these are the bare minimum that you require, so both of you agree on it. But later on, when you got surplus funds, one may want to buy one machine, other one may want to not buy a machine, invest in a property or something. So that is where the decision making becomes more and more difficult in the later stages of group practice. And there are personality and ego issues, some bit of politics being played by your staff. So many other factors start to come in there. So I think we have to be very careful and aware about these factors and plan accordingly. And just a sec. So the other option is when you have a one owner and multiple users model. Now here, this is the model that I have now for the past 4 years. The advantage of this system is there's a clear-cut chain of command and there's a well-defined responsibility. So anything good or bad happening in my organization is my fault or my credit. So I cannot kind of blame it on someone else. So I am the one responsible and I will take the decisions accordingly. It is much easier to implement the changes and the decisions in the organization because there is no confusion at the top. It is much easier to work with the visiting consultants because when so many people are coming and if there are 2 people or 3 people at the top, there will be a bit of confusing signals going from them, which is not so in case of a single owner model. This can happen in a multiple owner model, but the synchronization between the 2 or 3 people at the top has to be excellent, which many times we find is kind of lacking. And there is a uniform ethical and functional atmosphere in the center that you have. So basically whatever values that you have in the organization, you can just pass it on there. So there is no dispute happening there that, okay, I want this particular safety guidelines, but the other one may not be agreeing with that safety guidelines. There's a bit of a confusion happening. Out here, when you are the boss is kind of wanting something, the same thing has to percolate down to each and every one. The investment decisions have to be based on needs and productivity. And I just added this brackets afterwards, after listening to the previous talk, that we also have to keep the preference of visiting consultants in mind. So because I may be comfortable with a particular phaco machine and do my phaco with that, but if my visiting consultants are not comfortable with that machine, they want a higher end machine, I will have to buy that higher end machine because I have to keep them comfortable. So many times you have to take those decisions based on the other consultants also. Like if I'm buying a perimeter, I have to take my glaucoma expert opinion in mind also, that which particular perimeter is she interested in, because I may feel that both are good, but if she wants one particular thing, I will have to kind of adjust accordingly. So these adjustments have to be made based on the visiting consultants, but the ultimate decision is from the one owner only. Now the visiting consultants, as I told you, they can be 3 types of consultants we can have. One is those who provide the specialty care. So they are the ones who come in and they also fill in the role of specialist. For example, someone coming for glaucoma, pediatric, oculoplasty, or the other things. So like in my center, I do my cataract, LASIK, and retina surgeries. But for every other specialty, there is someone else. So if there is a squint that comes in, I don't touch that squint, that goes straight to my squint specialist. Similarly for glaucoma, for plasty, and the other things. So these doctors, they get their referrals from the clinic and from the other doctors also. Plus they bring in their own patients as well for their OPDs and their procedures. Now the second type is those who are coming in, they're probably doing only cataract or LASIK or other things, but they are using your facilities. They're coming and using your OPDs and investigation and IPD facilities. They don't expect any referrals from you, but they're looking at your facilities that which they want to use. And the third segment is those who are not having their OPDs at your center, but they're only sending their patients or bringing their patients for some investigations or the IPD facilities. For example, they want to do the OT, they want to do the LASIK, or they want to do the procedures which are covered by the TPAs and all, which they don't have at their smaller setup. So these are the 3 types of visiting consultants that we can have. Now, why do the visiting consultants come to us? There has to be something in it for them to come to us. So the advantage that they have is, one, they get cross referrals. So if they're coming to my place, they say a cornea person is coming to my place, he or she would get the other referrals of cornea from other colleagues also. So they straight away come into a pool where there is already 40, 50 doctors which are there. So they have that referral base that they already have it for them. There are no admin hassles that is there for them. And so they can just concentrate on their work. there's a regular updation of technology and equipments, because as I said, there's a faster ROI. So the equipments are more likely to be updated on a more regular basis, which in the individual practices, they would find it difficult to do that. All the TPAs, panels, NABH and statutory requirements are taken care of. So that way they work in a safe, comfortable environment. So they don't have to bother about those things. No pressure of staff salary, inventory, AMC, CMC, or the other hassles that are there. So for example, during the COVID times, they didn't have to bother about what salary has to be paid to the staff, even when the clinic was closed and the other things. That part was taken care by the management. So in a nutshell, sometimes that take home might be better than what they would be making otherwise from their own center without any of the hassles. So, it's kind of a win situation for them. So the question to ask, if it is such a win-win situation for the visiting consultants, why don't they come to the consult other places more often? So there are some concerns that they have. And before you run any kind of an establishment, you have to learn what are the pros and cons for the person who is coming to you, because you have to take care of those concerns that those people have. First thing and foremost that they're looking at is there's no poaching of their patients. They don't want that they bring the patients to my center and out there the person is told, why don't you come to us directly? Why do you come through that particular doctor? So this is where my goodwill of 21 years kind of came in handy, where they understood that these people are not into poaching patients. Like whenever a retina patient was referred to me, I would not do their cataract. So they know that these people are relatively more ethical. So that is one very, very important point. There should be no poaching of the patients. The patients who belong to other doctors should stay with the other doctors only. Other thing they're looking for is a proper due respect. At no stage they should be made to feel that this is not their own center. The staff has to be trained and retrained again and again to make sure that they respect the visiting consultants as much as they respect me or others, right? So these are the two most important things. Third and important is that there should be very, very simple and good accounting system. There should be very clear-cut accounting system where okay, this patient belongs to this doctor. This is the kind of a share that is decided for. This is the share that will be given. It has to be done on a monthly basis with predefined formats. It may not be perfect. We are not looking at taking care of each and every penny, because a perfect accounting system is more difficult to implement. But it should be simple and easily verifiable. So no one minds losing 2 or 3, 5,000 rupees here or there. But what is important, there should not be no confusion happening out there. And there should be a very transparent kind of a system. And the organization's culture for safety and ethics is very important, because if you have a particular culture, the like-minded people will be joining your organization. So they will be more comfortable coming to me if they know that, okay, out here, these people are ethical, they do a good job, they care about the safety of the staff, patients, and the doctors. So this goodwill has to be there for the doctors to come to you. Now, coming to what are the advantages are there to the center and the owner. The obvious advantage is there are more footfalls and revenues that are there for us. So as of today, about 40 to 50% of the total footfall in my center and revenues are coming from the visiting consultants. I still have a major chunk of my revenues, but still, the numbers are increasing for the visiting doctors. So for the same facility, my volume has kind of doubled without much of a extra requirement of equipments or the other things. There's a faster ROI on equipment, on investments, and better utilization of the machines. Cross referrals is an advantage, because I, being a retina specialist, many of these doctors who are coming to me, they refer their retina work to me as well. So that's an added benefit to me besides getting more ROI. And all the facilities are under the same roof, so I don't have to kind of refer my patients outside of the clinic. And all I need to do is the staff and system is already there. We just need to increase a bit more, make the systems a bit more robust, and we can get all the benefits. So these are the advantages that are there for the owner that are already there. The challenges are, we have to be accommodative for the bigger picture. We cannot be penny wise and pound foolish. So you have to, somewhere being the owner, you have to adjust. So for example, if one of my surgeon wants the OT at 10 o'clock and he prefers one particular OT compared to the other, I would adjust in a way that I finish my OT before 10, or if required, I'll move on to the other OT where he is not very comfortable with. But I have to try to make sure that the people who are coming to me are comfortable. So we have to be accommodative for them. The accounting, I always said that it need not be perfect, but it has to be simple. So be ready to make some adjustments in case some vitrectomy was required in a phaco. Don't be very finicky about charging for each and everything. Be there to help them out. Many times, because these people are doing phaco at my center, they require a retina thing during the surgery. There's a drop or there's a PC rent or something. I'm there, I go and help them out without any charges or anything. So that extra comfort cushioning that you're providing them is also helpful. You have to adapt your systems and accounts for the visiting and specialist doctors. It's very easy to keep an accounts for a single doctor or only two doctors. When you have multiple doctors coming in, you have to keep a track that this doctor was operated, this patient was seen by which doctor, operated by which doctor, what all consumables were used in that particular case. So, all the payouts are going to be decided on that. So for that, you have to have a system which is very, very robust. And for this, a good EMR is very, very useful. It's rather essential to run that. And there has to be a uniform set of rules for everyone in the center. You cannot have different rules for different people. So everyone would have more or less the same rules that will be there. And you have to actively ensure that your staff pays equal respect to the visiting consultants, because whatever you may say, the staff normally tends to respect only those who are paying them the salary check. So you have to actively ensure that your staff does not short treat the other consultants. They have to give equal or maybe more importance to them. So this thing is an ongoing exercise. You have to keep working on it regularly with your staff. Now, what are the tools that we have which we can use? So as I said, a very strong EMR system is very, very important. I am blessed with a very, very bad handwriting. So therefore, I adapted to an EMR much early. From 2003 onwards, I've been using an EMR. I've used multiple EMRs, and finally I've zeroed in onto a good EMR system that I'm using, and where I have very strong and transparent billing, accounting, appointment, OPD, IPD, inventory, everything I'm taking care of my EMR. And there has to be a dedicated person for handling the appointments for OPD and IPD. You have to ensure that the doctors who are coming to use your facilities don't have to wait too long. You have to know that which doctor takes how much of time. You have to organize the things much better way. And there should be a very strong TPA and IPD desk that is very, very important to handle the cashless cases. And we have to have regular interaction amongst our consultants also. We often have some Zoom meetings or something where we share something new that we have done, or we can also kind of tell them that what all things that we are doing in our center. That increases the bonding and also improves the cross-reference between us. And we always have to keep emphasizing that what are our organizational work ethics that are there, because that is very, very important, because one person, one bad fish can bring a bad name to you. So to make sure that everyone in the organization is following the same ethical standards that are required in your organization. Now, I'll end this talk with some learnings that I have in my life. I mean, I'll just share some things. It's just that one of the big statement that used to be made in my unit by Professor Tiwari, Professor H.K. Tiwari, that no one died of overwork. And this was the thing often said in the retina unit of RP Center. And this thing was instilled into our mind. You see, there's no shortcut to success. You have to work hard. So whatever I am is because of this kind of a rigorous training given to me by Professor Tiwari and by Professor Garg. They actually made me what I am. Other thing what I learned is that from anywhere you go, you learn something. You learn what to do and what not to do also. So being a retina specialist, initially I used to travel to not many places and I would see how they're doing things. I picked up some good things from them, and I also learned what not to do also from them. So you have to always be open to learning. I learned my ophthalmology at AIMS, but how to do practice I learned outside AIMS. I spent two or 3 days in Shankara Netralaya. I was in UK in Edinburgh. I was in UK in Nottingham under Professor Dua for a month for an observership. And so I kind of learned the finer aspects of practice out there, how to talk to the patients, how to maintain the records. I've learned from other people's OTs, OPDs, LASIK centers, etc., etc. And you have to continue learning new skills. So even after coming in practice, I picked up LASIK, I picked up femto-LASIK, I picked up MICS, MIVS, and so many other things. So you have to continue learning, and you learn from your failures and bad experiences. So we all will have our own setbacks also. Like my separation 4 years back was a bit uncomfortable, but you have to learn from them and move on and try not to keep any bitterness about it. So that is the most important thing. You have your downfalls or whatever, learn, move on, don't have any bitterness about it. And there's always an opportunity in every crisis. So this is very, very important. This whole COVID era has given me a lot of time to introspect and also to improve my systems. So while COVID was bad for many, but for me, it was a blessing in a disguise, because I could strengthen my EMR systems, my accounting systems and everything, and my safety measures that I could incorporate in my center. And after COVID, there are at least 4 or 5 new doctors who have joined my team, because one, they realize that this organization stands for safety and the other ethics. And also it is becoming more difficult for a standalone person to run the whole organization because of the statutory requirements, safety issues and all that. So in the future, I find there'll be more and more doctors joining this kind of a single owner practice systems, though it does increase the workload for me because there are more of statutory requirements that are coming up, but that is also an opportunity for me because those who are not able to tackle it have to join me. Do not take NABH as a burden. NABH is a boon for you. NABH tells you how to do things properly. It forces you to do things in a more systematic way. It forces you to take all the safety precautions. For example, the talk about the previous talk, they were talking about the fire safety and all those things. It is very essential because you have to learn and do those things because one fire can be devastating for you otherwise. And all the feedbacks, all the reporting and all that you're kind of looking at, all that can improve your efficiency quite a lot. And each one of us have to find our own strengths and weaknesses. There's no single plan that is going to work for you. I cannot copy the plan of some other person and exactly implement that in my own setup because I have my own strengths and my own weaknesses. So we have to learn from others, but make our own plans accordingly. So this is my last slide. So in the end, the synergy is very, very important between us, all the consultants, the referring physicians, patients, attendants, and even accountants and consultants that we have. And this part I just added today only while listening to the other talks that, you know, not only with the clinical aspects, but to be also be in synergy with our accountants and consultants, whether they are for HR, architect, etc., because we all have to work together for a smooth working. And a business relationship always has to be a win-win. At no cost, a business will work for you if you are kind of exploiting someone else, because sooner or later, the person who's getting exploited would realize, and this would not be a good idea for you. There can be a win-win where you also benefit and the person in front also benefit. His benefit doesn't have to come at a cost to you. That's the whole fund of synergy, that both of you can benefit of each other. And be honest in your approach, do what benefits everyone, and don't go for the short-term benefits at the cost of others, because that doesn't pay in the long run. So be honest, be sincere, take care of each other's goodwill and each other's well-being, and success will be yours. So, I mean, I'll just end here. I don't know whether I've been able to answer the question about how to have harmony in group practice, but I just shared my experiences. I'll be happy to take up any questions. Thank you.
Thank you, Dr. Vinay, for sharing your experiences, because that matters. And that one line which Jeff mentioned struck me most, because you may lose the battle, but never lose the lesson. It is very important.